Thank you for staying with us. Now, for the first time in South Africa's agricultural history, the Department of Agriculture has approved a poultry flu vaccine rollout, a decisive response to years of costly outbreaks that have crippled the industry. The vaccine, administered by Astral Foods to 200,000 broiler breeders, targets the H5 strain of the virus. This move is expected to build immunity, reduce culling and protect the food supply. Now, joining us is Dipepeneneng Serage, Deputy Director General for Agriculture Production and Biosecurity and Natural Resource Management to walk us through this groundbreaking milestone. Mr. Serage, I appreciate your time. Now, why has the department only now opted to begin poultry vaccinations despite repeated outbreaks in the past, which have cost millions?
Thank you very much for having us. In the past, we didn't even have the vaccine registered, so we just had the vaccine registered around 2023. So that's the first time we were able to register the vaccine. But obviously, vaccination for us is the last resort. If we could be able to prevent any outbreak through biosecurity measures, that's what we do. But we realized that that was not enough. Hence, we first had to have the H5 strain vaccine registered. And that's a process to register a vaccine. It took longer. And now we successfully had one vaccine registered. And then we're ready to vaccinate.
Now, you talk about vaccine being a measure of last resort. Why?
Ideally, you would want to adhere to biosecurity measures. Let's talk about poultry production. In poultry production, as we know, poultry houses have got to be biosecure environment. Workers, laborers going in and out of the poultry farms have got to adhere to biosecurity rules. They've got to shower, they've got to change PPE, they've got to wash vehicles entering into the farms, they've got to be washed. All those things taken. You ordinarily should not have an outbreak. But we've realized that over time, we despite all the biosecurity measures, I think it's the world over, realized that because with all the measures are not seeming to be able to prevent the outbreak, we then went about and registered vaccines. And vaccines are registered following a rigorous process that ensures the safety and ensures that only the strain about which the vaccine is produced for it gets dealt with. So you don't want to create a lot of other virus mutations and everything else. And so that was a careful step. And like I said, it's a last resort. Our first call of duty would be to have biosecurity measures, but it's not proving to be as successful as the measure, hence vaccination.
Mr. Serage, we're looking at vaccinating something around the region of 200,000 broiler breeders. What's the actual total number of broiler breeders in South Africa and the impact of just 200,000?
Yeah, so the 200,000 that was approved for Astral, it's the first step. We're talking millions. There's a lot of, at some point we spoke about close to 7 million birds that would be in production at any given point. You need to be mindful that broilers, broilers are the ones that are for meat, those are for a short lifespan of about not more than 6 weeks. So those ones would come and go. Then you've got layers, those that lay eggs for a longer lifespan of about 11 months. So combined, so it will be difficult to then work out a number because, like I said, the broilers come and go in 6 weeks, but the layers, you easily, at any given point, can talk to about 7 million birds that would be under production. So this rollout, the vaccination would be for the entire flock in the country. So you're starting with those that you can. We started with the Astral, and we'll be going on to the other farms, and this will be focusing on especially the layers, those that have got long lifespan.
Now, rigorous is obviously a word that comes to mind when you talk about the selection process. So walk us through what went into selecting Astral Foods as the first recipient of this permit, and how are they being monitored?
Yes, there are two very important points. Why Astral? How did it qualify? So we've established a protocol, basically a set of biosecurity rules to be adhered to before a farm can be approved to vaccinate. We need to know the farm has got to be biosecured. There's got to be proper record keeping. We've got to be animal health technicians allocated and veterinarians allocated. The disease is very sensitive, so you don't want anything that is not planned for going out of control. So you then have to ensure that there will be recorded. Each and every dose that goes into a chicken will be registered, will be recorded, and thereafter those chickens will be followed up. There will be samples taken periodically to ensure that we observe and monitor the behavior of the virus, especially this being the first vaccination. We're going to have to ensure that we don't end in as part of the vaccination end up rendering the virus endemic to the country. Endemic meaning it's taken as an outbreak and it should be contained and eradicated. You don't want to have a strain H5 strain circulating after the outbreak.
Mr. Serage, how many other organizations were a part of this selection process before you came up with the Astral Foods?
So there was what we call South African Poultry Producers Association. This comprises of the part that is about the broilers. This is the meat, and there's also the layers. So these are two companies which are part of the same South African Poultry Producers Association. These are in the main, but there are private other farmers who are not part of either of the two. They are also covered will be covered in the rollout. So you're talking two main associations or organizations and other individual farmers who are not a member of either of the two, but also will have to adhere to the rules and will have to apply and come forward. We've got a long list. In fact, almost all poultry farmers in the country are ready to be and have chosen to have their flocks vaccinated. So there's it's a big number that you're going to do. And talking about Gauteng alone easily can talk in the region of, if you count the birds themselves, easily 5 million birds around Gauteng. So there's a lot of chickens being produced in the country.
Now, are there any risks to consumers or farmers with this vaccine? And how is the department communicating those risks if they do indeed exist?
Part of the reason why it took us this long to have the vaccine first registered and eventually decide to vaccinate is we were busy trying to ensure that once we begin the process of vaccination, we do not pose risk to first the consumers and secondly biosecurity risks and thirdly not going to introduce the virus to other chickens, if you like, those that would not have been vaccinated. You can think of the backyard chickens and in the villages and all of those. So it took us time to try and come up with a process that once established, once implemented, the vaccination would not end up in chickens that were not vaccinated behaving the virus or mutating on them. So this was a very lengthy and tedious exercise. For instance, the safety, you spoke of safety. We can surely confirm that once if everything goes according to our plan, if vaccination happens according to our protocol, the guidelines, there shouldn't be any risks as far as the safety of the meat or safety of the products, the eggs and related products from poultry. So we've ensured that. And part of the registration, why it takes so long, why it takes so much time to register a vaccine is because we go into the thorough analysis of the vaccine itself to ensure that it does not, for instance, cause any harm or pose any harm or danger to consumers of the product, the egg or the chicken itself, the toxicology and a lot of other tests gets done before a vaccine is finally registered. But even after registration, we still ensure that the vaccine does not, or the virus once vaccinated, the virus does not mutate, does not go out of control. So hence there will be monitoring. Part of the reason why it took too long for us to have an agreement with the SAPA, Poultry Producers Association, is because we needed to work out the surveillance. You spoke of surveillance. We need to record each and every farm, each and every bird that receives the vaccine. You can imagine 200,000, that takes how long to have each and every chicken being vaccinated, and thereafter they're periodically monitoring to ensure that they testing them and ensure that the virus is suppressed once chickens get infected.
Now, final thoughts are always an issue around inclusion, particularly where black farmers are concerned. Now, walk us through how small-scale farmers are being included in this process or protected during the early phases of implementation.
They are protected, yes, but there's farmers who want to have their flocks or their poultry farms vaccinated will have to apply. And once they apply, either a state veterinarian or a private veterinarian registered with South African Veterinary Council will prescribe the vaccine. And once the vaccine is prescribed, then the whole process of vaccination starts. It starts with farm being checked for correctness and for biosecurity to ensure that the farm is biosecure, to ensure that the farm has got recording in place. The farm, everything has to ticks all boxes. And once that farm does that, then that happens. But the smallholder farmers, in this specific case, shouldn't have a problem, because once they are producing chickens in these numbers, it means they are commercial and it means they've got markets that they're going to supply to. Unless if you're referring to those that are farming in the villages, backyards, and all of those might not necessarily have to vaccinate. Hence, we're ensuring that those ones ought to be prevented or protected from getting in contact with those that are vaccinated. That's one tricky and balance that we're going to have to ensure that chickens that are from the vaccinated flocks do not end up getting into contact with chickens that have not been vaccinated. So all farmers that have a chance, poultry, all poultry farmers that are breeding or are operating the poultry business have got to come forward and have their flocks vaccinated. But I don't think there are smallholder farmers that would not have businesses. Those that are just like the go-go's and everybody at home, those shouldn't worry, because the intention is to ensure that once the vaccination happens, to ensure that the virus does not spread, and then it wouldn't even get to them.